It's taking a sweet time.
Hi, Jesse.
Time.
Did you have a good weekend?
There's many
Yeah,
things.
we got some Christmas shopping done.
Yeah.
Still behind.
We got some yard work done, got the rest of my leaves picked up.
Mm.
We have a big tree house in our backyard that is, the floorboards are too tight up against the tree.
So
We
we
spent
need
an
to,
hour with a skill saw,
Ooh,
sawing the boards away from the
Quick
tree.
skill.
And now I have to replace the floorboards and get a tree doctor out to make sure the tree isn't too sick from,
Oh.
it's,
run over
it's
into it.
semi-girdling.
It's gonna be a very shapely tree.
after the holidays, it'll be all. Do you have any kids that are still using it?
Wow, we got a picture of, us in the treehouse yesterday.
He's
Oh,
using
okay.
it.
I mean, that would be my home office, so no judgment.
Well, we had, built it 11, 12 years ago. So we have pictures of the kids at various stages
That's sweet.
growing up in it, but we have a grown-up kid picture yesterday.
All right, we're at like maybe 30 seconds until 8:30.
The audio is on, just so you guys know.
That's all. No, it's, oh. Are you messing with me? Oh, it's 8:30. Let's go.
This morning, I would like to discuss our Safer at Home order. Before we instituted the order on November 17, we were seeing an explosion in COVID-19 transmission in St. Louis County. The average was 40 at the beginning of October to 804 on November 17. Yesterday, that figure was 503. Thanks to good compliance in the community and the impact of our public health protocols, we've stopped the exponential rise in cases. And I want everyone to know that your sacrifices are paying off. To be clear, we still have too many cases. We still have a lot of virus circulating in the community. The CDC and the White House Task Force consider anything above about 145 new cases per day to be very high risk for a jurisdiction of our size. And our hospital systems remain dangerously stressed. We have a long way to go in our fight against this disease. However, when I announced the Safer at Home order, which includes a ban on indoor restaurant dining, I promised that we would closely monitor the numbers and make appropriate adjustments moving forward. I asked our Department of Public Health to collaborate with an informal group of restaurant advisors to come up with a plan that would allow limited indoor dining, along with some new safeguards aimed at reducing risk of transmission to restaurants. We expect that work to be completed this week. If the number of daily new cases of COVID-19 remains stable, I intend to announce details of the limited reopening plan sometime next week. As I said, the plan will include new restrictions as proposed by the Restaurant Working Group and our Department of Public Health. It's important to note that any form of indoor dining will still carry risk. But we believe that given the compliance in the community and the cooperation of the restaurant industry, we can agree on a plan to allow some form of indoor dining to return early next month. I want to thank our Restaurant Working Group for their diligence and collaboration. I also want to thank the vast majority of our restaurants in our county that have complied with all the public health orders to keep their customers and employees safe. There's lots of work to do to get there, but recent trends are encouraging. We need to keep wearing our masks, avoiding crowds, maintaining distance from others, washing your hands frequently and thoroughly, and listening to the healthcare experts. This will get us through this pandemic. Last week, our hospitals began administering the COVID-19 vaccine to their healthcare workers. This week, that process is expected to begin in our long-term care facilities. And on Sunday, shipments of Moderna's COVID-19 vaccine left warehouses, heading for 3,700 locations across the country. With 2 FDA-approved vaccines now available, excitement and hope grows. We are on track to curb this virus that is certainly a bright spot during a very challenging 2020. And I share that hope on this shortest day of the year during what seems like one of the longest years in recent memory. But with that hope, we must continue our vigilance. Our hospitals are packed, and the virus continues to quickly spread throughout the community. Wide access to the vaccine remains months away. This week, many of us will be celebrating Christmas. We can keep our traditions, but alter them to keep us safe. Please restrict travel and restrict gatherings. Celebrate with those in your bubble, with no more than 10 people. The best way we can show our love for our loved ones is to do all we can to keep them safe during the holidays. Thank you. Any questions, Doug?
Yeah, from Channel 2, they wanted to ask, can you detail any restrictions at this point or safeguards that would be put in place that prompted, or the safeguards that we put in place that would prompt you to feel comfortable moving forward with the plan?
So the question is about new restrictions on indoor dining, and our Department of Public Health is still working on those restrictions with the restaurant working group. We're not ready to discuss any of those details yet. We're still working on those details, but we're excited about the progress, and we want to recognize the collaboration of our restaurant working group, similar to all other business sectors in St. Louis County who have struggled with the impact on their businesses by this COVID-19 pandemic.
Can you answer the other one basically in your remarks? But some of the reasons for what the case levels had gone down as to why you were looking at this now?
Well, we always committed with every protocol from our public health department that we would continue to monitor the data and make adjustments based on those trends. And we're starting to see a flattening of the curve in St. Louis County. We're still not there yet, but we're starting to see a flattening. So we want to make sure that we're having these conversations now about what it would look like in the future, expecting those numbers to continue to go in the right direction, expecting compliance to continue in our community, and offering us an opportunity to ease some of those public health programs.
That's all I have.
Okay, thank you.